So let me ask the next question to Dr. Hoyen. We just received a question about ultrasound. What do we actually look for? What do you find on ultrasound when you have a carpal tunnel syndrome?
Yeah, that's a good question because sometimes you'll even combine the ultrasound with the injection that Dr. Barr has mentioned. It's important to look at or evaluate the nerve up in this area as it goes towards the hand, and it's often difficult to actually see the nerve exactly within the carpal tunnel because of the thickness of the palm. But what we see is that if the nerve is compressed, and we've talked about this nerve compression, and sort of what is it? If the nerve is this size, right, and it goes into the carpal tunnel, and now it's this thin, what happens to the nerve just before it enters the carpal tunnel? Sort of like if a hose is kinked outside, what happens to that hose? It's going to get bigger before it gets kinked, and that's one of the things. And we can see the edge of that compression, we can see the thinning of the nerve, but what we really can see on the ultrasound is how much bigger the nerve gets just before it enters the carpal tunnel. What's nice about the ultrasound is that it also allows you to identify other things that might be involved with the nerve that we wouldn't necessarily expect. So I think that as we go forward, the diagnosis is important. Again, we'll emphasize it's the history, the exam, adding the other tests, the ultrasound, and the electrodiagnostics as well. And we have a couple of people here that do ultrasound. So if someone wants to comment on other findings or other important things, go ahead.
Yeah, thank you.